Morning, good morning, good morning. This is Valley Area Agency on Aging, and I am Yashika Albert, President and CEO. We are doing a wonderful interview with one of our Sapphire sponsor stars, somebody who has supported us for a very, very long time. And I will let this young lady introduce herself.
I'm Erica Wheeler with Helping Hand Nursing Service, Home Health Care, CEO.
Okay. First of all, again, I told you this before we started recording, though, that I want to, again, and I feel like I repeat myself a lot, but there's no other way to say thank you other than just simply saying thank you for the work that you do with Valley, the partnership you have with Valley, your presence in the community, and the long amount of time that you've worked with Valley. I think I was the person that brought Helping Hand on as a provider. Oh, that just really go to show how long we've been working together. I was the person that brought Helping Hand on as a provider way back when I started doing contract management. I think. Do you know how long you've been working with VAAA?
I know I've worked with VAAA for all of my 25 years here. So for me, it's forever.
Yeah, yeah. We've been
Yeah.
we've been working together for a long, long, long time. Why is the partnership important?
It's important to me because of what VAAA represents in the community and how you guys are out there educating and providing resources and care for the seniors in the community who are often looked over. And that's important to me because the business we're in, we're here to provide help. We're here to make sure nobody goes uncared for. And that's that's the biggest thing about this business. And what you guys do, um, it gives back to the community, and that's something I'm honored. I'm proud to be part of that. I want to do something that makes a difference too. I want to get the word out there that there are resources, there are things for seniors. They don't have to just be left forgotten, and they can still have quality of life.
Yeah, that's one of the things I hear from seniors in the community that they feel, that they don't have a voice. No one listens to them anymore. No one is there to help meet their needs. So I totally can relate to that. What type of services do you provide for seniors?
We provide non-medical home care. So that includes your home health aid, which is your personal care, light housekeeping, bathing, transportation, errands to doctor's appointments, companionship. We also provide some skilled services as far as the private skilled services go, nursing, LPN, RN, so people that need medication management, or maybe they need wound care, or they have certain um, things equipment that needs to be handled by a skilled professional. So we also get into the skilled nursing side of it as well. But primarily, and a lot for VAAA, we do just the day-to-day ADLs, keeping people in their home, keeping people making sure they're checked on, and they're being cared for, they're taking their medication,
Mhm.
all of those important things.
Yeah, and then too, it's important to note that you take clients from other programs and organizations, and not and just from the community, not just with VAAA. So I want to make that clear that you don't have to be a VAAA client to receive Helping Hand services,
No,
right?
no, we do a lot. We've got a variety. Another one of our really big programs that we work with is the VA. So we do contract with the VA, and we do care for the veterans, and that's another passion of mine, is reaching out to the veterans and making sure that they're getting the services and the care that they need as well, because a lot of times veterans don't realize that it's available to them either. So that's a lot of work we do, in addition to that, as well as catastrophic care, people who have been injured in car accidents,
Oh,
um,
okay.
quadriplegics, paraplegics, ventilators, trachs. We do a lot of the auto, no fault catastrophic, and that's where our nurses come in to play a lot of time for private duty. That's something I'm proud of because we kind of specialize in that. We've been doing it for many years, and I do work with a lot of those particular cases personally. So,
Okay, see, I learned something new. I didn't know that you worked with the auto insurance to do that care.
yep.
That's majorly important. That can go hand in hand with being able to get that long-term care insurance too, to cover that cost after the car insurance, if they cover it, or if they once it cuts off. So I didn't know that. Good. I learned something new today. So leading into that question in terms of what you provide, why, in your opinion, is it important for seniors to receive care in their home?
I think that the quality of life is definitely much better for them when they can remain in their own home environment. A lot of times, going into a facility, they just um, let it's they give up, like I'm out of my home, my pets are gone, I'm not in my normal surroundings, and then you just start to see a decline. And our goal is, if we can keep them participating in their own life with help, because you can't do everything on your own, but when you have somebody helping you, checking in on you, and maybe helping you get through the more difficult things that are getting harder for you as you age, then you can still feel that independence, and you can still feel that um, you have your own life, your own home, and you have a little bit of help, but you're still an individual, and someone is caring for you, and they're checking on you, and I think it just gives that it's more of a positive uh, environment for them. A lot of elderly people have their pets, which that's huge. That's a really big thing, because that those are their comfort,
Mhm.
and us being able to be part of keeping them at home is it's really a privilege.
It is. It is. It really is. I, my grandmother passed quite a while ago, and I sit back and I think, man, I wish I would have taken advantage of those opportunities, just to sit and talk to her, and just learn. She tried to teach me how to sew. I didn't want to learn how to sew, and you know, now I wish I would have learned how to sew. Just to be able to have that generational information passed down, going to your grandparents' home, sitting down, talking to them. Something about doing that in the home, in their home, that
Mhm.
makes it a bit more bonding too. And so yeah, I get it. People want to age in their home as much as possible. They want to age where they choose to age, and
Mhm.
that's majorly important. What is something unique that you provide, or your organization provides, for seniors?
Um, well, I think we do a lot of things differently. One of them, I guess I already mentioned, was we do the catastrophic care, which I think a lot of people didn't realize that we have those capabilities. Um, but I think how we manage our staff, our education, our orientation processes, um, and the oversight we have on each of our individual clients, I think is probably I, I'm going to say top of the line. I'm not being biased, but we have our clinical nurse supervisors. They're out, they're checking on our clients. They're making sure that, they're being cared for properly. They're educating staff, they're training. We have education requirements that everybody has to meet, and our background checking and everything we do to vet our staff to make sure we're getting the quality out to our clients' homes, because there's so many in this business there that you have to be careful. You have to
Mhm.
make sure you know what you're getting, and these are vulnerable. It's our vulnerable population, so it's important to us to make sure that we're giving them the best possible care. One of the things that somebody told me that I guess I didn't realize was unique, but it must be because I took a I took a call from a gentleman one day who was calling looking for services for a family member, and he told me he couldn't believe that somebody picked up the phone and he was talking to a human. He said he had been
Oh
searching,
my
he lived in
goodness.
another state and he had been searching for help for his sister who lived here. And he said everybody that he tried to reach out to, either he got automated messages that said they would call him back, or he had to um, contact them online, like through like a, and we'll reach back out to you type situation. So when he got me on the phone and I'm talking to him about the care and different things and options that he can do and what it entails, he said, I I'm just surprised that, you guys actually have human beings. I said, well, we have human beings here taking your call 24/7. So that's one thing we don't do. We don't utilize automated systems. It's always one of our people here that are talking with our clients and our staff 24/7. So,
Oh, okay, okay. And I also like the fact that you mentioned pets. So many of our seniors, I mean, their pets are their companions. Their pets are their babies. Is there
mhm.
anything that you do to assist, with making pets more comfortable while you're providing care for seniors?
Well, one of the things we do is we always make sure when we're matching, we match a caregiver that is okay and comfortable with pets and who likes pets because, they might have to let the dog in or out or, maybe give them a little bit of food or something like that.
Hmm.
Um, they aren't required to do major care for the animals, but if you have a client who's bedbound and can't let their dog in or out, then our staff can do that.
Hmm.
Um, the other thing too is, and like you said, they're babies, and it made me think of something. I had a client once, and I remember this is back when I was a scheduler, and I'm matching up people, and I remember I was putting an aid with the client, and um, I told the aide, I said, when you walk into this home, the first thing you're going to do is you're going to greet the dog, and you are going to talk to that dog, and you are going to make sure that use your baby voice, whatever you got to do, but that dog is that's the queen. Like, you're going to make sure you greet that dog. I said, if you don't do that, you're going to have to turn right back around. and, and I think that that's really the important thing, is, in this business, we're in people's homes. So you have to realize, especially too with their pets or their family members that might live there, these are their people. These are, so you have to have that compassion. You have to have that understanding. So you can't go into somebody, oh, get your dog away from me or get your cat. You have to make sure you're treating them well too. And I think that gives our senior just that sense of just comfort, and they can feel that. And someone's doing that for their loved one, whether it be a dog, cat, or whatever. It's that level of just peace and ease that you can give them without even realizing it, because the pets mean so much.
Hmm. Yes, they do. And then final question. Um, Share a funny or heartwarming story about how you or your organization has assisted a senior. Just a really quick something that that you did to for a senior or even a caregiver that kind of stands out to you.
Oh gosh, well, we have so many things that, as far as people coming up to us, that maybe we took care of a parent or a grandparent, and they see us out at events or see us in the community, and they recognize us, and they come up and tell us the stories about how much help it was to have our staff in there. Um, One in particular had to do with a hospice patient, who we had come in kind of toward the end. And we were the family had asked us to be in there because um, they were exhausted. They were tired, and they just wanted to be able to spend that time with their loved one without having to also provide the care, or, they just wanted to be the child or be the grandchild. And they told us that our staff, our caregivers, were so kind and compassionate, and they did such a good job that it made it more peaceful and easier for them. It was like a comfort to have them there. They didn't feel so alone in what they were going through. So it's not only for the client, it turns out, it's also for the family members, because they're getting a sense of peace as well. Like, they've got support, they've got comfort, they're not alone, and there's somebody there that can help them through it. So those types of stories are always really heartwarming for me to hear, and it just it's nice to know that you do make a difference, just a little bit at a time, that something you did or your company did changed somebody's life as far as how they feel about a process or a situation now. So I would say those sorts of things. And of course, there's always those situations where, if you have a senior who is vulnerable, and your staff's going in to check on them, and there are times, your staff gets there and maybe somebody's fallen, which we've had, because our staff isn't necessarily in the home 24/7, and someone's fallen, and we were able to get them help, because our staff had arrived at their scheduled time, found them, and we were able to get them help and potentially save lives. So those sorts of stories too are really, it's just amazing that how much you can actually do. You don't realize, how you're changing somebody's life, because if you weren't there, then you don't know what could have potentially happened.
Yeah, we don't often get to see the impact that our empathy has with the clients and the caregivers. So that's one of the cool things about being able to go into the home. A lot of organizations, Valley still goes into the home to do assessments and reassessments and things of that nature, but a lot of organizations don't do that anymore. So the fact that you emphasize that your team has that empathy, and then you can see it translated to your seniors and the caregivers. That makes a major difference. So again, I want to thank you just for our quick Sapphire second. Again, thanking you for always supporting Valley, and specifically for being a Sapphire sponsor. Just so you know, we all get excited at Senior Power Day because we all come around to see what your theme is. So you're known at your table having different themes every year. So we're like, okay, didn't she do Hawaii or Luau? And then one year she did Mardi Gras. So
Oh, you just wait. You just wait. I already, after Senior Power Day last year, it came to me, because I'm like, we're gonna do better. Like, how am I gonna top this? How am I gonna top Mardi Gras? So I've got it. So
okay.
we're gonna bring it again this year. Don't worry.
Okay, we look for it. So just so you know, you've started a trend within the office that we all come and look and see what you're doing at your station. So, but again, thank you, Erica, for everything that you and your organization does for not just with VAAA, but for our community.
You're very welcome. Thank you.